Hi there, my name is Ashley and I work on the communications team at Children's Wisconsin. COVID-19 has proved to be immensely challenging, especially for families, but there is hope coming from the vaccinations. The emergency use approval of COVID-19 vaccines is the greatest hope we have in getting back to life as normal, or as normal as it can be after a pandemic. The vaccines will help kids get back in the classroom, competing with their teammates, and enjoying family traditions. But the most important thing is that the vaccine will help save lives. We have a very smart group of people joining me today to help us better understand the COVID-19 vaccine process and where we are with getting vaccines to people, including kids. The experts joining me today from their homes and offices, hence why we aren't wearing masks at the moment, are Dr. Smriti Kari, President of Primary Care at Children's Wisconsin, Dr. Daniel Dorington, Pediatrician at Forest View Pediatrics, Dr. Christian McAlpin-Tesfaye, Pediatrician at Good Hope Pediatrics, Dr. Frank Zhu, Medical Director of Infection Prevention at Children's Wisconsin and Assistant Professor of Pediatrics at the Medical College of Wisconsin, Dr. Dave Marcolis, Bone Marrow Transplant Program Director at Children's Wisconsin and the Interim Chair for the Department of Pediatrics at the Medical College of Wisconsin, Dr. Timothy Corden, Medical Director of the Special Needs Program at Children's Wisconsin and the Chief of the Special Needs Program and Professor at the Medical College of Wisconsin, and Dr. Amelia Arana, Director of Pediatrics at 16th Street Clinic. We have heard from many families who have questions about the vaccines. When will the vaccines be approved for kids? Will some kids be eligible before others? What about parents and guardians with underlying health conditions, or even someone who is the sole caregiver to a child with complex medical needs? We will answer those questions and more throughout this conversation. Please continue to submit questions in the comments throughout this discussion. We plan to cover as many of them as we can in the next hour. Before we jump in, I want to note that this conversation will be based on the information available to us today, February 25th. And we're aware that as more information becomes available, these discussions may shift or adjust. All right, let's jump in. Thanks to each of you for taking time to answer questions today. Let's start with how the vaccines are impacting kids. Dr. Kari, many families know that kids under the age of 16 were not part of the first clinical trials for the vaccines that are currently being used. What's the timeline for vaccines to be approved for younger kids?
Thanks, Ashley. So I think most people have heard so far that Pfizer vaccine has been the only vaccine that's been approved for 16 and up. And what we know today is that there's clinical trials going on with Pfizer vaccine for kids from between the ages of 12 and 18. The Moderna vaccine is currently approved for 18 and up, and they are still working on getting their clinical trial completely populated and be able to do that. So those two trials are on their way. All of the other vaccines will probably eventually do pediatric trials. So I think that's one of the things that most people don't always think of is the way this is going to work is the approval for kids will probably come in stages. So the first group, it will be 12 to 18 years of age. And then after that, we'll probably move further down, 12 to 9 years of age, and then 9 to 6 years of age. And so this is going to be a process that will take many months. And we're not entirely certain when we're going to know all of these results, but we do anticipate they'll probably be late spring, early summer before we have approval going further down for kids. And this isn't entirely a new process. I mean, it's often when we're looking at things like vaccine development or drug development, you're looking for the most vulnerable population to work with first. And, you know, in adults, this was a much more severe disease. And so that's where everybody started. And so it's not unusual for pediatric trials to come after adult trials. But that's kind of what we're looking at right now.
Okay, and do we anticipate that kids will be eligible to receive the Pfizer vaccine once the clinical trial is completed, assuming the data indicates the vaccine is safe?
So that depends. And I think it depends on the supply of the vaccine and the availability of the vaccine. It's been an immensely complicated process, the vaccine supply and distribution, and everybody really wants to safely get the vaccine into as many arms as we can, and that's the goal. So when I say it sort of depends, we have a lot of folks who are already eligible for the vaccine, and they're kind of waiting through to be able to get it based on the availability. And so even if the kids are technically approved to get the vaccine, the phasing will still continue because that is something that's based on the supply that's available. One of the things that I think is good data points to remember is 2.9 million kids, and this is based on data that was from early in February, they've tested positive for the virus. And if not all states report the data based on age, but from what we know, this is about 13% of the positive cases. And we know that we have this complication called the multi-system inflammatory syndrome in children. And about 2,000 children in the United States actually had this syndrome. And so it is a disease that is of concern in kids. And so, we want to make sure that we protect the kids. And, so as my hope is that the vaccine supply continues to improve, like we've been seeing all indications of that. And when that happens, when kids are eligible and there's a vaccine approved for them, we will work as hard as we can to get them to the kids as fast as we can. This vaccinating kids is also a big part of herd immunity, and it really helps to protect the community. So it's, for all those reasons, this would be very important to do. But for a majority of kids, it's probably going to be summer or early fall before we can have them vaccinated.
Okay, thank you. Dr. Zhu, what about other vaccines being studied? Have kids been part of their clinical trials?
Right, so there are a lot of other vaccine candidates that are currently in the process of being studied, around 69 or so that are currently undergoing clinical trials, and perhaps 20 or so have reached the final stage of testing. So, all these vaccines are being developed as fast as you can, but you can't really anticipate the timelines, and they're not all quite the same. So they have to certainly follow a certain process to ensure that they're first safe and then they're efficacious. And as a physician myself, I'm very confident in the vaccine development process. And I've received the vaccination myself and would recommend my family to get it as well when they are qualify. As for children, children tend to be sort of later on in these sort of vaccine process. As Smriti, Dr. Carey mentioned, Pfizer is the only group that has studied children in their emergency use authorization, and that was only in a very small group of 16 to 18-year-olds. So currently, the other vaccines such as AstraZeneca and Johnson & Johnson have not yet begun testing in children.
Okay, what about adult caregivers or family members? Should they be cautious about getting the vaccine since it's only been approved for emergency use? And along with that, do you think the vaccine will be safe for kids? What are your thoughts?
Well, I think the ultimate decision is, each family situation is different. You should make an informed decision with your own doctor and your child's pediatrician. In terms of vaccine safety, I think that while it has only been approved for emergency use, and certainly the emergency use authorization was accelerated given the pandemic, we have determined that it has been safe to be used. And one of the biggest selling points is that we've already given out millions and millions of doses of these vaccines, and we have not seen a significantly increased or different rate of side effects in this vaccine compared to historical vaccines.
Okay, and then Dr. Kari mentioned something called MIS-C or MIS-C. Can you talk a little bit about that?
Right. So MIS-C is a post-infectious process in children where after they've been exposed to the virus, some weeks later, the average is around 30 days, they develop the body's immune system develops a very large inflammatory reaction to it, and it looks like they're quite ill. But it is a ultimately rare condition. You know, only a few thousand cases out of the multiple millions of children that have been infected have been reported, and we have seen a few and treated these cases in children's, and generally, you know, the kids respond well to treatment and are able to go home without incident.
Okay, thank you very much. Dr. Corden, over the last few weeks, we've heard from families and children who have complex medical conditions and are being cared for at home. Are parents of these kids eligible to receive the vaccine?
Yeah, this is a really important and great question, Ashley. The short answer is yes. They're eligible, and they're eligible to receive it right now. The state has designated them really as frontline care workers, because that's really what they do. They provide so much personal care at home, a lot of medical attention to children who have very complex needs at home. And it's so essential that they be protected so they can continue to do that work, and that they are not going to be transmitting things to their children. But I do want to stress, so the state has sent out specific letters, who is eligible. It's very specific. It does include families that are covered in the Katie Beckett program, long-term support waiver, programs of that nature. And we've still heard from some families that they're having some difficulty in getting the vaccine. And you know, we're all pretty excited that starting next week, Children's will be able to offer a limited amount of vaccine and appointments to some of these families. And since we have information about their eligibility within our system, also, we will be communicating directly with those eligible families via email or text or MyChart to try to arrange these appointments. So it's very important for families to keep this contact information up to date and in their MyChart accounts, and we will be reaching out to them. Again, it's very exciting, and we really want to offer that to help protect these caregivers, and it's going to be it's a nice option.
Great, thank you. Dr. Kari, you have been helping guide the team here at Children's, setting up our Children's Wisconsin COVID-19 vaccine clinic. What else should listeners and families know? You're on mute. I'm going to warn you before you start.
The tech world. So I really appreciated what Dr. Corden started off with, and this is an exciting time. So, you know, we talked about how we're still working through pediatric trials for the vaccine, but we are aware that kids older than 16, starting March 1st, some of the kids become eligible for the vaccine, and particularly these are children who are under 19 years of age for the Katie Beckett program, or under 22 years of age for the long-term waiver program. These are children who should be living at home with their family and meet the definition of being disabled as defined by the Social Security Act. These are children who also require a level of care that is typically provided in a hospital, but it's being done in the child's home. So, you know, often the children are dependent on technology and other devices like ventilators and dialysis and such. And so that's the group that we will be working with first. And we are also going to offer some limited opportunities for the caregivers of these children, again, as defined by the state for the eligibility criteria, to be able to get the vaccine as well. And so I said earlier that, you know, vaccine distribution is complicated by the supplies available. And so to be able to really streamline this and manage this well, we will be contacting families that we know meet this criteria and inviting them to schedule an appointment for the vaccine based on the amount of vaccine that we have available every week. So really, really important for the families to make sure that they have updated information in their MyChart chart accounts so that we can reach them and be able to make sure that they get the information about how to schedule these appointments. And so, the other thing is, as Dr. Corden mentioned, we're particularly wanting to prioritize the children that that have the special needs, and that we want to make sure that we're coordinating things with that. And while we know that, we'll have to start slow based on the volumes of vaccines that we have available, as that, as our availability and supply of vaccines increases, we'll also increase the number of opportunities available for kids and families to be able to get their vaccines. The most important thing is for people who are eligible, who have information, who fit this criteria that our state has approved next. It's important for them to be able to get the vaccine. So, so we are encouraging everybody to look for opportunities, call your local health department, call your primary care doctors, ask where they're recommending vaccination to happen as well. And we'll try and support all of those efforts and try and get as many people vaccinated as we can.
Thank you, Dr. Kari. All right, Dr. Marcolis, there are many other patients with underlying medical conditions that put them at a greater risk for health complications if they get COVID-19. For example, individuals who are immunocompromised. What do we know about when they may be eligible to get the vaccine?
Well, that's another $1 trillion question, and it is supply and demand and science. No matter their age, even if they're 16 or older, if they don't meet the criteria that Dr. Kari just identified, those kids or young adults are not part of the next group identified by the state. We follow the rules. We live in the state of Wisconsin, and we will continue to advocate for those rules and follow those rules. We all want what's best for these kids and these families. And this is, you can imagine, as a bone marrow transplant doctor, this has been a hot topic of conversation in our clinic for months. And we will continue to seek guidance from the state and from the CDC. As more vaccines are approved and supply increases, I think that we will see more people become eligible for the vaccine. And then we will, just like Dr. Kari said, we will be able to offer those vaccines. And then once again, agreeing with everything that's been said by everybody else. If you are eligible for the vaccine, if somebody in your family is eligible for the vaccine, whether they are 95 or 16, for whatever the reason, particularly those families that were called out by Dr. Corden, those caregivers of those special need kids who are under these state programs, please work to get that vaccine.
Okay. Dr. Dorington, we're going to go to you. What are some of the questions and concerns you're hearing about in primary care?
We're definitely getting a lot of questions in the primary care world. Some of our patients have received the letters that they will be eligible. And so, as previously discussed, they have been asking us when they can get the vaccine, and we're letting them know that we'll be contacting them. As sad as it is, I am reading about reports of nationwide COVID vaccine fraud schemes. The federal government has spent a lot of money ensuring that the vaccine will be no cost for anyone. And so it's very important that if people should not be receiving text messages from individuals other than their healthcare system, phone calls, emails, if they are asked for money to move up in the queue to get access to the COVID vaccine, or to provide money of any sort, then that is definitely fraudulent, and they should not provide financial information or personal information. They basically need to trust their healthcare providers. We have a process in place where we will be contacting individuals when they're eligible, and the vaccine should be of no cost to everyone. In some circumstances, there might be a nominal administration fee that should be covered by insurances.
Okay, good to know. Thank you. Dr. Arana, if kids aren't reacting to COVID-19 as extremely as adults when they get it, should they even get the vaccine? And you're on mute.
Ashley, and it's really important to keep in mind that the more people that gets vaccinated, the more protected that community is going to be at large. So getting vaccinated to kids and families will help get that herd immunity that we're aiming for. And I can remind everyone that herd immunity means that enough people in that community are immune to a disease, and that's going to make the spread of the disease really unlikely. And that's our goal. We want all communities to be protected. In general, we know that the community is protected when we achieve that goal of 70% of the population being immune to the disease. And considering that children are 20% of the population, that's a very important number, a very good number of patients or kids to be vaccinated. Herd immunity can be achieved by natural infection, but we have to imagine that to achieve 70% of the population being immune through natural immunity, that means a lot of people would get sick and have complications. So although we are achieving herd immunity through natural infection, having people vaccinated is going to be a huge help to get to that goal. In general, the pediatric population and children do not get really complicated COVID-19, but as we mentioned before, we know and we have heard many kids unfortunately get the multi-system inflammatory disease, and that can get really complicated and have some consequences and damage organs like heart or lungs or kidneys. And we don't want children to get any complications from this disease. That's why it's important that the pediatric population should get vaccinated. And we're hopeful Pfizer and Moderna have ongoing trials for the vaccines. And of course, we'll need to wait for FDA approval and review. But I think we have a lot to. It's really promising, and we hope that the vaccines get approved for the pediatric patients, hopefully by the end of the year.
Okay. Dr. Dorington and Dr. McAlpin testify. If a family chooses not to get vaccinated, would the way that we care for them change? Let's start with you, Dr. Dorington.
Definitely not. It wouldn't be the first time that we had recommended a medical intervention, and a family ultimately gets to make the final decision and oftentimes will decide not to do what we recommend. If we think a vaccine is safe for a child, we're going to recommend it. If they decide not to vaccinate, we're going to continue to care for them as we always did. We're partners in their health care. We may continue to have the conversation about why we think it's a good vaccine and a safe vaccine, but we certainly wouldn't change our care for them.
Okay, and what about you, Dr. McAlpin testify?
I think it's important to remember that there are a lot of reasons why a family may hesitate to vaccinate. It's important that we discuss those concerns openly. Some questions are more about the science and logic. Others, people have more personal concerns, or they have concerns because of previous past injustices. So when I'm talking with the family, I want them to be open and honest, talk about their reasons why, but I really want to help them make an informed decision.
Okay, and then what about the question about schools? Should I wait to send a child back to school until they get the vaccine?
It's a popular question, and my short answer is no. If your school is able to implement physical distancing practices requiring masks, the recommendation really has been for kids to be at school. Studies have been done this past year, and all the data indicates that school environments are not significant factors of spread.
Okay, thank you. Dr. Kari, do you have anything to add to that one?
Yeah, I think that's well said. There have been some very promising studies that have shown that when schools have done a really good job of strictly implementing mitigation strategies like masking and social distancing and screening and cohorting and things like that, kids have stayed safe. There was a study out of North Carolina where there are 90,000 kids who are in person school, where they really did a good job with their mitigation strategies. And they really were able to show that while they did have some cases, most of them they could trace to a community exposure rather than a school exposure. I think our teachers have been heroes and have worked really hard to keep kids safe, and that's really been the most amazing thing through this very difficult year. One of the things that we've worked with a lot of school districts, and one of the things that we recognize is that we have the Center for Disease Control recommendations, and then our Department of Health and Human Services recommendations that tell us about safety measures that schools can take. But ultimately, whether a school is open or closed is a local decision that the school boards and superintendents are making with the input of their community, and we support that very much. And we believe with the vaccine available, if we can have our teachers vaccinated, our educators and school personnel vaccinated, we're going to keep schools even safer. And so we really are excited to be able to do that now. So that's where we are with the journey around schools right now.
Okay. Well, before we dive into questions submitted during the conversation here, can you each take a moment to tell us what you want everyone to know about the COVID-19 vaccines? I'm going to start with you, Dr. Kari.
So the pandemic's been difficult. It's disrupted all of our lives. And when I think about children, it's been particularly hard for them to, lose what they were used to, their social connections and all of that. So the vaccine to me is a moment of hope. It's a pathway to, changing some of these things that we've had and getting kids back to school. And so it's an exciting moment.
Thank you. All right, Dr. Dorington.
My experience over the past year has been, it's been an extremely difficult year as a pediatrician, and I agree with Dr. Kari that the vaccine provides hope. It's been very difficult seeing incredibly high rates of anxiety and depression and suicidal ideation, even suicide attempts, substance abuse in children, all that are dramatically higher than I've ever seen in my career. And I really hope that we can develop some herd immunity, because children need to be in school, they need social connection, and it's been a very difficult year, not just for me, but more so for my patients. And for those who have concerns, please call your provider, My Chart Us, we're here for you.
Okay. All right, Dr. McAlpin-Tesfaye.
So being a pediatrician, I echo what everybody else has said, but also being a person of color, I know that there are a lot of fears regarding the vaccine coming out so quickly, et cetera. I really would like people to know that it is safe. I received the vaccine. Many people in my family have received the vaccine. I'm also a parent to a child with special needs. And so for me, it was really important to help protect her. So I just want people to realize this vaccine is there for a reason, promote that herd immunity, but also make an impact so that we can hopefully get out of this pandemic. But we can't reiterate enough that people are dying from COVID-19, not the vaccine. So I hope people think about getting the vaccine moving forward.
Yeah, thank you. Dr. Zhu?
Yeah, well, first I would just like to say that, despite the, incredible shortness and speed that we have developed these vaccines, they have been shown to be safe after giving millions of doses. But even after that, we need to continue to be vigilant, wear masks, practice social distancing. A vaccine doesn't really make you bulletproof. It gives you better protection, but you can still transmit the virus.
Okay. Dr. Marcolis.
You're mute.
You're on mute.
I'm on mute, and I got so ingrained in listening to the comments, I forgot your question, Ashley. To be very honest with you. Now you're on mute.
Very general. Can you take a quick moment to tell us what you want us to know about the COVID vaccine?
I think it's safe. I think it's effective. I think I think it's a vaccine that is a game changer for our communities. And I am thrilled that my mom has received the vaccine. I'm thrilled that I've received the vaccine. And I look forward to the date that my patients can receive the vaccine.
Okay, thank you. Dr. Corden.
Well, I think everyone has said it perfectly. It's remarkable science. It truly gives us a chance to be on offense a little bit with this disease and virus. To do something that really gives us that light at the end of the tunnel that we can get through this. And as everyone's said, I believe it's safe. It's certainly effective. I certainly encourage it for all the caregivers out there who are providing, such wonderful care to their adults in need or children in need at home. So it's something that, and I agree with Dr. Zhu as well. We need to still mask and have social distancing, but it really is provides us so much hope.
Yeah, okay. Dr. Arana.
Yes, I would like everyone to know that we have safe vaccines that have been tested in so many people already, and we are not seeing any significant side effects. So we can trust that that's the best choice is to get vaccinated. In my daily practice, unfortunately, we're seeing the consequences of this pandemic in many ways. We're seeing a lot of, unfortunately, kids that are not active as they should, or they are eating at home more often than they should. So the magnitude of the obesity epidemic we're seeing is like we've never been witnessing before, and that's not good for those kids and their families. Also mental health issues, because kids need that social environment at school. They need to play together. They need to have relationships, friends, and talk to their teachers. So we're missing a lot when the schools are closed. And the vaccines are going to give us that way out of this problem, that way out to that new normal we are all looking forward to. The vaccines are safe. And I want everyone to remember that the vaccines are 100% effective in preventing complications. So if you get vaccinated, if you get the doses that you have to get, no one is going to end up in the hospital. No one is going to end up in intensive care. People don't die. The vaccine is 100% safe, 100% effective to prevent COVID-19 complications.
Thank you. That's a very good note to end that question on. We're now going to jump into questions provided by the audience. A quick reminder that we will be trying to answer as many questions as possible right now, but we will continue to answer questions in the comments after this conversation. Let's start with a couple questions that were asked in response to the event that was posted over the last couple of days. I think we're going to start with Dr. Marcolis here. Is there a plan or list for patients to sign up on if they are part of the adult congenital heart program, since most often or often they are over at 18 and high risk?
So we'll follow the state guidelines. And I think our adult congenital heart patients, so you're 18 to 25, your bone marrow transplant survivor who's 23. Now, if you are an adult congenital survivor, and you are a healthcare worker, go get your vaccine. I've had my own patients who are now young adults who are in the healthcare arena as healthcare workers getting the vaccine. So as look at what your opportunities are and why. And once you become eligible because of your medical condition, which is not yet, we will then get those vaccine appointments to you. I hope I answered that question, but I would look at all of the reasons why somebody might be a candidate to get the vaccine. And so one of my best moments recently on Facebook was seeing one of my bone marrow transplant survivors, who's a nurse at Freighter, get her vaccine in the last 2 weeks, which is just really cool.
That is very cool. All right, let's move to, I think this next one will be a good one for Dr. Dorington. Given that elementary children won't be likely to receive the vaccine anytime soon, When do you think they should be participating in extracurricular activities such as sports, swim lessons, things like that?
I hope it won't be too much longer. Certainly, kids need those activities and that social connection. I think actually it's going to depend on the level of rates in the area that people live in, and then also the safety plan for activities. We have had some patients who've continued to participate in sports like basketball, and it really kind of depends on that safety plan. It's still going to be very important for kids to be screened for fever and signs of illness before they go to practice, to try to eliminate grouping, to maintain cohorts, and when at all possible to be outside. So I wish I had a crystal ball to kind of tell you when that would be, but I think it's family dependent and also dependent on the rates in their area.
Okay. And then Dr. McAlpin-Tesfaye, I'm curious, building off of that, would you wait until you or your child are vaccinated before you do these types of activities? What's your recommendation?
So my situation is a little bit different than other people. I have a child who is, has special needs, and so she's a little more at risk for certain things. However, she is going to school 5 days a week. They have their mitigating practices at her school. So if it's something where I feel like there's physical distancing, I say you can definitely try it. If you get there and it doesn't feel safe or comfortable to you, you can always try a different activity for your children. But again, like Dr. Dorington said, it's family dependent. And so I would definitely reach out to whatever activity you're interested in and find more out.
Ashley, one more comment. They also, I believe on the CDC website, have ranked sporting activities in degree of risk, from low risk, moderate risk to high risk. So that's another thing that people, in addition to the safety plan for that specific event or activity, they could look at and see how high risk the activity is.
That's a really good point. Thank you, Dr. Dorington. We actually did a live stream similar to this one on sports, and Dr. Walter spoke specifically to that and actually helped do the guidelines that came from the state of Wisconsin. So those are available online as well. Yes, Dr. McAlpin-Tesfaye.
I was just going to add, I agree with Dr. Arana. The kids do need to get outside, move around. You don't have to have your children confined to the house. They can go out and play out in the snow. They can go outside and run around, take walks around the block, as long as you're not around your neighbors, etc. There are things that you can do that are safe, just to get your kids moving around and doing some kind of physical activity.
And I think most people have really struggled with screen time. I think it feels like some of my patients admittedly are saying 24/7 Fortnite or Minecraft. And so anytime we can get outside and get the kids involved in activities, that's definitely going to help their mental and physical well-being. So
the weather this week is helping with that compared to the last couple weeks, so that's good. All right, we're going to jump into some questions that were submitted live here while we were having a conversation. So we're going to navigate this as best we can. The first one I think will be for Dr. Kari. What are the recommendations regarding the vaccine for mothers who are breastfeeding? This is a very common question.
Yes, for sure. We've heard this one before. So there was a lot of talk about this because the initial trials that were done for the vaccine excluded pregnant women and breastfeeding women. It turns out that while they did the trials, some women did get pregnant, and they did eventually get some data from breastfeeding women as well. Since we've been actually approved for the vaccination, there are many, many thousands, millions of doses of the vaccine that have been given. Many pregnant women and many breastfeeding women have been able to receive the vaccine. And as we've been looking at the follow-up data, it seems like the safety profile is pretty good for both. So right now, the recommendation is that it is safe to receive the vaccine if you're pregnant or breastfeeding. We do always encourage that women check in with their their own physicians around that and have a conversation about that, especially if they have concerns. But that's what that's what we know right now about the vaccine safety.
Okay. And then I think the next one will be good for Dr. Margolis. What are the recommendations regarding the vaccine for kids with bleeding disorders?
So thanks for the softball. We've been vaccinating kids with bleeding disorders for generations, and I would view this vaccine the same as any other vaccine. You, based on your individual bleeding disorder, you work with your hematologist. Most of the time, it's get the vaccine. And what I was taught by my mentor, Dr. Joan Gill, may she rest in peace, is 15 minutes of pressure, no look. This is what happens when you look. You give up the pressure. So she always said 15 minutes of pressure, no look. But I would feel very confident. And the national societies have actually come out, the American Society of Hematology and the pediatric group of that. And if you're eligible for the vaccine, otherwise the bleeding disorder, we can handle.
Okay. Dr. Zhu, I think we're going to start with you for the next one. If you were a parent and you wanted to enroll your child in a clinical trial, are those available? What would be the first step in finding those and enrolling?
Yeah, that's a good question, because the first step would be actually finding these clinical trials and contacting whoever is in charge of enrollment for them. So there isn't a great way to sort of go about this at this time, but I would send you to the NIH website, where they have, not just for children, but for adults as well, where you can volunteer to participate in COVID-19 clinical trials. And then I would contact them through their contact us information and ask about any trials in children that you would be interested in. I think that would be the easiest way to get contact someone who's more centrally located, who can sort of send you in the right direction to look.
Okay, great. I think we might stay with you for this next one. Does the vaccine prevent transmission of the virus to others, or only protect the person who is vaccinated?
Right. So transmission was not evaluated as part of the clinical trials for vaccine efficacy. So we don't know if there is any protection in transmission, but we only know that they protect you against developing mild, moderate, or severe COVID. What I would say is that most likely, if you are vaccinated, your likelihood to transmit is less. With other respiratory viruses, we have seen lower viral loads in your nasal pharynx, which would be consistent with being less likely to transmit, but not zero. And because of that, we continue to recommend social distancing, wearing a mask, and all these other precautions, even if you have been vaccinated.
Okay. Dr. Marcolis, I think we're going back to you for the next one. With new mutations popping up, is it the goal to still achieve herd immunity, or will this just become a game of cat and mouse between the virus and the vaccine?
So I'll see if Frank approves of my answer. I've been a pediatrician taking care of immune-compromised children for 25 years. And I've been playing cat and mouse with bugs for my entire career. And so with coronavirus, we're going to keep playing cat and mouse. But the good news is we continue to bet on science. And we will tend to follow. And so the bug will mutate. And the best example I'm going to give you is influenza. Influenza, we've all had the influenza vaccine for years and years and years. And still, people get sick and can die from influenza. So that's why it's so important every year that we get the influenza vaccine. For coronavirus, I don't know what's going to happen down the road, but I think we are going to learn to live as a society with coronavirus. We will learn to play cat and mouse. We will get back to accepting. And I hope that this desire for vaccines for coronavirus will even bleed into influenza and other bugs that we deal with to prevent. So the bugs are always going to change. That's their job. And as scientists, our job is to maybe stay even or occasionally ahead of them. Look at smallpox. Smallpox is basically eradicated. Polio, basically eradicated. Measles, we learned that you have to do a second vaccine. We learned that in 1989 when I was an intern. So the bottom line is we'll play cat and mouse, but please play with us. Please play with us.
Okay, I think we'll stay with you for the next one.
Okay.
What kind of support is available for families that are staying isolated with immune-compromised kids?
Oh, that's a wonderful question. If you're inpatient at the Mac Fun Center, we have wonderful child life. If you're at home, it's the same issues that Dr. Dorington and the others were talking about before. We worry about the isolation. We worry about that. Our immune-compromised kids face this every year. And one of my colleagues said, this is actually their superpower. Our immune-compromised families know how to wash their hands. They know how to wear a mask. They know how to social distance because they've had to do that for every bug known to mankind. So for our immune-compromised patients, if you're in the hospital, we have wonderful child life. We have wonderful recreation therapy. We do that safely. If you're at home, continue to reach out to us. Continue to look for creative things to do. And the weather's breaking, and we're all going to be able to get outside. And the outside, I've always told families every year, get outside, enjoy the summer. You're not going to get a virus from hanging out outside.
Okay, thank you. Dr. Zhu, let's go to you for the next one. How long do we anticipate the coverage or effectiveness of the vaccine will last in children? Is there any reason to think it would be different than in adults?
Well, we don't know how long the coverage or effectiveness of the vaccine will last in adults at this point. That was also something that was not studied in these trials. So we'll sort of have to play it by ear and see how long that is. In terms of children versus adults, children generally have, fairly robust immune systems. So we would anticipate that they would have similar responses, and they probably have a better response than, say, the people at highest risk for COVID-19, those 65 and older who, immune systems have begun to wane.
Okay. And Dr. Marcolis, we're going to go back to you again. You're very popular right now.
Is it about the bucks? Is it about the bucks?
No, not yet. No questions about the bucks yet. Will bone marrow donors still be eligible to donate if they've had the COVID vaccine?
The most recent guidance I saw from the National Marrow Donor Program was yes. And I would make sure these guidances keep changing on a day-to-day basis. And so if you're a patient who is going to be a recipient, you can trust that the worldwide network is talking to each other and making sure that process is safe for your donor. If you're going to be a donor, please discuss with your donor collection team, and they will give you the guidance that is most up to date.
Okay.
And thank you for being a donor, and thank you for registering to be a donor,
yes.
or and signing your license to be a solid organ donor card.
Yes, our teams very much appreciate that.
There's our free 15 seconds.
All right, Dr. Kari. Once the vaccine is approved for children under 16, where do we expect patients will have to go at Children's Wisconsin to get it?
Great question. So we currently are planning a central vaccine clinic on campus. And part of the reason for that is we're receiving the Pfizer vaccine, which it requires the ultra cold storage. Now, I understand today something came out that said that we might be able to do something differently with the Pfizer vaccine, but it's a complicated vaccine to put together and to be able to deliver. So we're doing a centralized clinic to be able to do that. We are, our primary care clinics have been approved as vaccinator sites. And so our hope is as we go further into this vaccine journey, we're able to deliver the vaccine at multiple locations as well. Again, sort of depending on how easy it is to be able to give the vaccine and schedule it and do that work. So that planning is going to continue to happen. We want to make it as easy as we can for everybody to get their vaccines.
Okay. Dr. Dorington, I'm going to go to you with a general question. We've gotten some questions about safety, and we've heard of something called VSafe. Can you talk a little bit about that?
I definitely can. So as someone who received the COVID vaccine as a children's employee, I was very impressed with how smooth the process was, from check-in to receiving the vaccine to after receiving the vaccine, spending 15 to 20 minutes in a room social distancing to make sure there was no reaction. The follow-up vaccine will likely be scheduled the booster dose before you leave. And the CDC has come up with a new vaccine safety program that is really neat. In the era of smartphones, they have come up with an app called VSafe that you can see on the CDC website. And when you enter your information on VSafe, including the date of the vaccine, you'll receive periodic text messages and questionnaires asking how you're feeling. And it's just a new kind of neat way to track adverse events from the vaccine. Historically, we've used something called the Vaccine Adverse Events Reporting System, or VAERS. And this is an important system as well that providers will use, but never before has there been something like VSafe that will go directly to the person who's been vaccinated. And I think it's going to be a really effective way to track side effects.
Okay, great. Thank you. Before we wrap up the conversation, I would just like to go to each of you again to see if there's anything else you want to mention, anything we've missed. So let's start with Dr. Kari.
Thanks, Ashley. So I think you started this conversation with saying that the information we're sharing today is the information that we have on the 25th of February. And I think that's one of the things that I would say is keep talking about this, keep educating yourself, because one of the things about this illness, as well as the vaccination, has been that this is rapidly evolving and there's new information available every day. And so keep yourself as informed as you can as you make these decisions.
Okay. Dr. Dorington, let's go to you next.
I want to thank you for the opportunity to take part in this. I think we're all ready for this pandemic to be over, and we've all seen the effects, both just financially and mental health-wise, physical health-wise. Because of the large population of children in this country, children are going to need to be part of the solution to develop herd immunity. And so we'll be starting with 16 and up, and as the clinical trials continue, if that age range is reduced, as Dr. Kari mentioned, down to age 12 or to age 9, your providers and the children's health system will definitely be in touch in regards to if we recommend it, is it safe, and who's eligible.
Okay, let's jump to Dr. McAlpin-Tesfaye.
I know we're all focused on the COVID-19 vaccine, but I just want to reiterate, please get the other vaccinations for your children. It's really important so that kids aren't getting multiple illnesses all at once. It's already been a difficult year, and as people start to socialize more, some of these illnesses are obviously going to be back in the community. So just please, this year, remember to get those vaccines for your kids.
Thank you. Dr. Zhu.
I would just like to, point out that to please not delay necessary medical care for your children because of the pandemic. We've taken the necessary infection control precautions to provide safe care for both you and both protect you, your families, and our healthcare providers.
Okay, and Dr. Marcolis.
Well, I think it's just one of those what I learned in kindergarten things. It's time. We need to continue to be kind to each other, kind to ourselves. This pandemic has been incredibly stressful. It's been a year. It's been a year. And so as we keep going, let's remember to be kind to each other, be kind to others, and treat everybody with respect and dignity.
Yes, thank you. Dr. Corden.
Well, it's been a pleasure talking with some wonderful colleagues and to be able to present tonight. The reality is we're all in this together, and the way out of this is to have this virus not be able to infect the next person. And a vaccine will help that, but still wearing a mask, social distancing, washing your hands, that'll do it too. So there's all these things we can do, and we'll just stop this thing and all move forward together in a way that we get our lives back and we all get to hug each other again. And that will be a wonderful thing.
Thank you. And Dr. Arana.
Yes, I just want everyone to remember that the vaccine is one of the strongest tools we have to get out of this pandemic situation. One of the things to keep in mind is where we get the information from. Unfortunately, there's a lot of misinformation out there in the media and internet, so let's be careful where we learn from. Always reach out to your pediatrician, to your doctor if you have questions regarding the vaccines. One of the most frequent questions I get from parents is about the side effects of the vaccines. And I want to clarify what means a side effect and what means a coincidence with some people that in the news say that they had some severe consequences about the vaccines, and that's not really true. Most of people don't get any side effects. Some people report that kind of muscle sore after the vaccine. After the second dose, some people report headaches or very, very mild fever. There are no serious complications, no serious side effects. Something to remember, if anyone is allergic to any vaccine, it's important to talk to your doctor about that. And we know how to take care of those patients. Everyone needs to have 15 minutes observation. But if you ever had an allergic reaction to any vaccine, we prefer those patients to stay with us for 30 minutes. And we know that if in the unlikely case of an allergic reaction, all the medications that we know to use for allergies work really well. So even if that person had a history of an allergy to a vaccine, we are safe, you are in safe hands, and we can administer the vaccines to those patients too.
Great, thank you so much. That is all the time we have for tonight. However, we will continue the conversation on this topic and answer as many questions as possible in the comments, so continue the conversation there. Thanks to all of the doctors here for taking the time to answer our questions tonight. A second live Q&A will be streamed on Facebook, YouTube, and Twitter on Wednesday, March 3rd at 7 p.m. that will focus on vaccine myths and common questions. Was the vaccine developed too quickly? Are there long-term side effects? Do I need the vaccine if I already had COVID-19? Will the vaccine alter my DNA? Tune in for answers to those questions and more. As always, the team at Children's Wisconsin is here to support you, so please do not hesitate to call your child's doctor's office, use MyChart messaging, or our online urgent care. If you have any questions about Children's Wisconsin or COVID-19, you can visit childrenswi.org/coronavirus. There you can find all kinds of resources, from details about children's locations to blog posts on topics like this one. Thanks everybody for watching.